For all the new second years out there or any other medical student, you might have suffered from pathology or you might struggle with it right now. So in this video, I'll give a practical guide on how to study pathology. I've struggled with it initially myself. In fact, it took me many months to understand how to study for pathology, but now I figured out what to do, and I will give you a list of materials that you will need, textbooks and other resources, as step by step explaining on how to approach the textbooks, guide on how to answer case-based questions on pathology, and I will also tell you the one most important thing that you must do to make all these other steps very easy. You can use the timestamps provided below to skip to the relevant sections, or stick around and listen to the entire thing, which I recommend. The gameplay in the background is just to keep the video interesting, not related to the video, obviously. Part 1. Resources. There are multiple resources where you can study pathology from that is simplified or even high yield, but you must only refer to those reviewers if you know your textbook really well. The textbook, as ever, I suggest is Robbins' Pathologic Basis of Disease. I'll put an Amazon link down below where you can buy it. Specifically, I remember Robbins or Mini Robbins to learn 90% of the textbook. You don't have to study the big textbook, only use it to refer to the microscopic images. I do not personally recommend you start with Pathoma or even any other online reviewers or expensive study materials, or any other videos for that matter on YouTube. I studied everything from textbook and it actually works, and it's on a budget. So, let me preparing notes, part 2. Once you open Robbins, it will look intimidating, even the Pocket Robbins, which in itself is a simplified version of the main Robbins. The textbook is divided into 2 sections. General pathology, where you will learn about basic disease process like inflammation, coagulation, necrosis, apoptosis, basic cell functions. Dedicated chapters on neoplasia and immune system, genetic base of disease, infectious disease, and even pediatric diseases. All of these are quite handy to understand systemic pathology, which comes up later on from chapter 12. All the other channels, all the other YouTube channels will recommend you to study these chapters well, and I agree with them to an extent. You don't have to read entire chapters for general pathology. For cell injury and death, the second chapter, you must only learn the important parts like what is necrosis, what is apoptosis, how it works. Try to simplify each and every topic into one single line. Like necrosis, extremely pink cells on H&E stain due to high amounts of eosinophils, and appearance is glassy. Coagulative necrosis, where there is protein denaturation, it's the most common type, all tissues except brain. And if limbs are involved, it's gangrenous, which is from diabetes or infectious or poor blood supply. And gaseous necrosis, which is specific only for TB, where there is a huge hole or a big spot in the X-ray and even the microscope. And that's it. And there's another fat necrosis if pancreas are damaged, where you'll see fatty vacuoles. And liquefactive necrosis for brain, it is due to abscess formation due to meningitis or any other infection. It doesn't have any protein denaturation, and that's all you got to know for most MCQ based exams. Just try to summarize the topic, each part into simplified forms. You can actually ask ChatGPT a quick tip: copy and paste the text from the textbook and ask ChatGPT to simplify it for you. It does rather a good job. I didn't have that luxury a couple of years ago, but now you can. Even 3.5 works amazingly well. Now, yes, you will fail your exams, and that's perfectly okay. That's how you learn. I failed patho exams multiple times as well, but I managed it at the end when I understood how to actually prepare notes. And this video is to simplify it for all of you from the very beginning. Now, the most important part. Don't skip these parts. Answering case-based MCQs. This and the next part are quite important, the clinical pulse. So watch this carefully. Case-based MCQs are often very long and have a ton of information, of which 90% is irrelevant. To find the relevant 10%, you must know your Robbins really well. And you must solve the reviewers. Robbins Reviewer is an amazing resource to help you understand those questions. The questions are given in a way that are deliberately confusing you, which is to be expected, so cut the clutter. The answer is in the question and in the details. Now, to make these easy and to know which parts of the question are relevant, you must prepare clinical pearls by yourself, or you can even ask ChatGPT to find some important clinical pearls from each topic in the textbook. Each disorder, note down only the important points. Summarize the disorder into 4 parts. 1 line each, 4 lines, like it's the cause, what causes it. If it's genetic, then what is the gene involved. 2 very unique clinical features for that disease, and then its microscopic features if there are any specific microscopic findings. That's it. That's all you need to solve almost all of MCQs of pathology for any exam. Now, that ends the video here. However, if you want to follow up to this video and if you want more details, leave it in the comments below if you have any doubts. I will make it into a separate video. I might even explain a sample chapter, one chapter, and explain how you actually study it. And for now, happy studying, Robbins, and like, share and subscribe for more such tips. Thank you.